Namibia has a universal social grants that it meets out to its people. There are specifically two that one can mention that falls under the Ministry of Poverty Eradication and Social Welfare. One is the Old Age Grant, which is a universal grant and is, in terms of the Constitution, enshrined in Article 95F, that the government make sure that all its citizenry is provided with some means once they have attained the age of 60 years to live a decent life. And as such, this old age grant is given to people who have attained the age of 60, irrespective of their position or their standing in life. Then we have got the disability grant, which is also a universal grant, which is given to all the people that have been certified as disabled by a state medical doctor. And once the certification process has been completed and the approval is granted, both the old age grant and the disability grant is currently paid at the level of 1,000 Namibian dollars, which is an equivalent of South African rand. Namibia has also what we call children's grant, which is administered under the Ministry of Gender Equality and Child Welfare. Children's grant has got three categories that they are following. It's the maintenance grant, it is the orphans and vulnerable children assistance, and we have also the foster parent allowance. All these grants are paid to each child at the level of 250 Namibian dollars, and it doesn't matter how many children you have. The only instance where we have some sort of a targeted intervention is for the maintenance grant, where it is required that one parent must have been deceased or incarcerated, and the other parent who is now applying should not earn more than 1,000 Namibian dollars. But efforts are underway to see whether also the targeted intervention could be removed and the grant be made universal. In addition to that, under the Ministry of Labour, we have got the Social Security Commission. The Social Security Commission is a state-owned enterprise that functions in an autonomous manner away from the ministry, but reports to the ministry on a quarterly and annual basis. Under the Social Security Commission, we have got several programs. The most popular one is the maternity, sick leave and death benefit. Maternity for the working woman, sick leave when injured on duty, and death benefit if you would die in lieu of performance. Then we have got the Employers' Compensation Fund, which take care of the hospital bills in the event that you are injured on duty, and also has a component that deals with the pension that you will be paid if you have been injured on duty. So also it provides for a small grant that will ensure that you are taken care of until you return back to work. Then we have got three other programs that is currently being worked on. One is the National Pension Fund, that would be a contributory pension fund that is specifically engineered to include those that have got low wages and naturally does not have a pension facility arranged at their workplace so that they are covered adequately at the time of retirement. And we have got the Medical Benefit Fund. In Namibia, we have got different medical aids. The government has its own medical aid, but we have also a universal healthcare system. However, some of the more tertiary health instances where people needed some complicated operations, then the universal healthcare would not cover it. In such instances, these people need medical care, and as a result, the Medical Benefit Fund is an agency that needs to be implemented. The last one is the unemployment allowance that is currently The only part that is missing from Namibia's quest to ratify Convention 102 of 1952, which is the only component that we still not have in place. And efforts have been made, and some documentary work has taken place in order to make sure that all these specific parts that are still outstanding under the Civil Security Commission would eventually also be implemented. Now, Namibia has realized that at the end of the day, the old age grant and the disability grant contributes to the decrease in poverty as well as the inequality. Evidence has been achieved that the old age grant alone has brought down the Gini coefficient of Namibia with 0.003 points, and while the degree of inequality, that is your Gini coefficient, was around 0.7 at 1994, it stands now at 0.59, which is a commendable reduction that has taken place. And the impact of this reduction was as a result of the old age grant and the disability grant that were provided to the citizens in a universal manner.